Hi, very good morning, students. So today we'll be taking, as I said earlier, also, so image-based question, and we'll try to take all the possible questions on image-based questions which are asked in our exam. So it will be easy to understand if we take all these questions and image-based questions. It's very easy. If you have seen those images, if you're trying to analyze it, and if you understand the concept behind, means from which topic it is, so it's easy to answer. There is not much in that, but it's important to comprehend those images. Okay, so let's start. Okay, the first question, image-based question. If you see, let me take my pen. Yeah. So if you see, this is an image. It's a statistical diagram. The question asks you, the statistical diagram shown in the figure is referred to as. What is this? So if you see there, it's a graphical representation of something. So you have odd ratio, you have certain lines, horizontal lines with small boxes. Some boxes are big, some boxes are small. Then you have a diamond shaped structure. So here it is Smith et al., Jones et al., Smith et al., NG et al., Chu et al. So what can we make out? So if we can make out that, okay, there are individual studies, no? Okay, there are individual studies, students, which has been done, and all the individual studies has been plotted. Okay, so when you have such structure, when all the individual studies have been plotted, so if you on the same topic, if you take many studies which has been done by different people, and when you try to analyze those, so as you know, we call it as meta-analysis. So whenever you are doing meta-analysis, there is a possibility you can plot this thing. So what is exactly? So individual studies taken, I have plotted here. So the answer to this question is forest plot. Now let's try to understand what is forest plot. As you saw the picture, students, it is a graphical display, simple, of the estimated results from all the studies, from the number of scientific studies, means all the studies which was done, which we have taken, and all the study addresses the same questions. Okay, so the topic on which the studies has been done, or the question is same. So there can be multiple studies I have done, you have done, somebody else has done. So when I'm doing a meta-analysis, I try to pull out all those studies, bring out all those studies, and try to analyze it. And when we plot those studies, it is called forest plot. Now try to understand how it is done. It is very easy. So you see, we take a horizontal axis and then we take a vertical line. Now if you see this vertical line, this is your line of null effect. Now what is this line of null effect? Line of null effect, as the name says, no, null effect, it indicates that there is no association between exposure and outcome. There is no association between exposure and outcome. There is no relationship, or there is no difference between two intervention. Okay, simple. Line of null effect, like null hypothesis, null effect. There is no association, or there is no difference between two intervention. So how do we do that? We have a horizontal axis. On that we plot. Either when we take relative statistics, it becomes we have to take odd ratio or relative risk, or when we are taking absolute statistics, we can take absolute risk. When we are taking relative statistics, where you take odd ratio or relative risk, then the null effect value is 1. And when you are taking absolute statistics, students, the value is 0. So in this you can see the line of null effect. We have taken odd ratio relative statistics, so it is 1. So based on this discussion, one thing is very sure. Okay, there is a horizontal axis where you're plotting your relative risk, and then you have a line of null effect which indicates that there is no association. Okay. Now once we know that, let's try to see. So you have what you can see in this picture. So there is a small box, this, and you have a line, no, horizontal line. Again, there is a small box, there is a horizontal line. Again, there is a small box, there is a horizontal line. So can I say this whole box with horizontal line is a study, is one study, this is another study, this is another study. Okay. Now see, each horizontal line, which I said this, each horizontal line put on a forest plot represent a separate study. So this is study 1, this is study 2, this is study 3. Okay. Okay. If you see each study, each horizontal line has got a box. No, here also, and here also. This box estimates its point estimate of the study. Okay. Now this point estimate, if you see the size of the box, it is bigger here, it is smaller here, it is smallest here. The bigger the box, the more participant in the study. Okay. When the sample is more in the study, the box will be bigger. When the sample is less, the box will be smaller. Now you see there is a horizontal line. No? There is a horizontal line each to the box connected. So this indicates confidence interval of the study. Okay, like you see, this is the confidence interval of the study. This is the confidence interval for this study. Okay, so 3 studies I have shown. Now you see the same thing I have put here. This study does not crosses the line of null effect. This study crosses the line of null effect. This also crosses the line of null effect. So any study line which crosses the line of null effect does not illustrate a statistically significant result. So these 2 studies has crossed the line of null effect. So it is not showing that, it is not indicative of significance. So there is no significant result. This has not crossed. So possibly there is this result has illustrate a statistically significant result. Okay. Now, what is the interpretation? The bigger the study, means you have more samples in that, smaller will be the confidence interval. Means smaller will be the horizontal line. And when bigger the study, smaller is the horizontal line, bigger is the black box. Okay. What does this mean? When the sample size is more, when the participants are more, so as you know, when the samples are more, the errors are less. So the confidence interval will be less, means the horizontal line will be small, and the point estimate will be big. This means that it has got less possibility of crossing the line of null effect. But when the samples are less, smaller the study, wider the horizontal line, see. So they have got probability of crossing the line of null effect more. Okay. So what can, again you see, so as I said, there's this box, this study, this study, this study, this study. But at the bottom, students, you see you have a diamond. What is this diamond? And it is vertically it has been linked. Just see, the diamond represent the point estimate and confidence interval when you combine and average all the individual study. Means in a summary, in a simple way, it is the summary of all the studies we have plotted. So this is the diamond. Now if you draw a vertical line through the vertical points of the diamond, they represent the point estimate of the average studies, and the horizontal line which represent the confidence interval. The rule of crossing the line of null effect is still here also, students. If the horizontal tips, means this one, crosses the vertical line, the combined result is potentially not significant. The same logic, if it doesn't crosses this, it is significant. If it crosses this, it is not significant. So this is your forest plot, students. Very easy. You take a line of null effect, you take a x-axis where you plot your relative risk or absolute risk or odd ratio, whatever you have. And each study is plotted with the small box and the confidence interval. And just when the study is big, the box will be big, the confidence interval will be less. So there is less possibility of crossing the line of null effect. Smaller the study, bigger the confidence interval, smaller will be the box. So they have got possibility of crossing the line of null effect. Okay, and when you average all those, again so when you average all the studies, you get a diamond shape structure, which is the average of all vertical points of the diamond. If you join, so that is point estimate, and the horizontal one is the confidence interval. Again, the same thing. If it crosses the line of null effect, overall it is not significant. If it doesn't crosses, then you can say it is significant. Okay, so this is forest plot. I hope this is simple. Okay. Now let's take the second question. So you have a second question, students. So there is if you see the image, so they're talking about something about network analysis. So they're just asking you, what is the critical path in the given image? What do you think? 3, 6, 9, 5. Now how do you answer such question? So if you see the question, there is a starting point, there is the finish point. So starting points we do with task A, then task B. Then from after you complete task A, you can do task D. After you complete task D, you task E, and you can finally you can finish this way. Or if you start here, again you do task A, and directly also you can finish here. Or one way is doing task B, task C, and then finish. So what has to be done in this, students? We have to always take what are the all possible paths. Okay, now you see. So one possible path is this way. Wait. So I write here start A, D, E, and finish. Right? Now this path is the line which I have drawn. Second can be start A and direct finish. And third is start B, C, and finish. So one path, second one, and the third one like this. Now nothing you have to do, students. Just take the time duration which is mentioned. So if first I say it is written 3 plus 3 plus 3. Second I take only 3 it is written. And third I take 2 plus 4. Right? So it is 9, it is 3, it is 6. So the critical path is the longest path, students. Please remember, critical path is always longest. So here we have 9 days. So we'll go with the answer 9. So the critical path always happens to be the longest path. So the answer will be 9th. Okay, simple. So this is a part of management, network analysis, quantitative management, where you have program evaluation, review technique, where you break all the smaller works and you plot a network and try to say what is the time required for each activity. That there can be concurrent activity going on, there can be subsequent activity. So when you plot from start till end, then you have the various paths. In all those paths, which path is the longest path? So that will be the deciding factor, because if that gets delayed, your overall project gets delayed. So when you plot that, so when you see which path is the longest one, so your focus will be more on that, so that doesn't get stopped, because that is taking the longest time. So that is critical path. Okay. Now, you must have seen this symbol. What does this symbol relates to? Is this symbol relates to health promotion, primary health care, SDG, MDG? Now, if we talk about this, this talks about students' health promotion. Okay, I'll just show you. So this is health promotion. Now, please remember that in that symbol was for Ottawa Charter. Ottawa Charter. Ottawa is a capital of Canada. Okay, so there was a conference on health promotion, and so whatever recommendation they gave, that became Ottawa Charter. Now you see, this was held in Ottawa. I am You will see I am talking about Ottawa. I'm taking the name of Ottawa because that has got significance and that will help you to remember for long term. So this was held for in November 1986. Now, you remember 1978 we had this Alma Ata conference on primary healthcare. So from 1978 onwards, we were trying to focus on primary healthcare concept given by that Alma Ata conference. After that, 1978 and 86, you see 8 years, we had a Ottawa Charter on health promotion. Okay, so Ottawa Charter is built on primary health care concept given at the conference Alma Ata. Now, so one thing it talks about health promotion, okay, and it was held in Ottawa. Now, if you see the symbol, students, it has got a one. This red one has got a outside circle. You have a round spot. You see inside the round spot. This round spot basically talks about the strategies. So you have enable, mediate, advocate. No, enable, mediate, advocate. Then you have three wings. If you see one wing crosses the circle, bigger circle also. So that talks about develop personal skill, strengthen community action. The second wing talks about create supportive environment. And the third one talks about reorient health services. And the outer circle is talking about build public health policy. Now you see what is this? So this is basically the interpretation of the image. So you have a big circle which talks about public health policy. The smaller circle inside that it talks about the strategy, enable, mediate, advocate, and then the three wings are development of personal skill, community action strengthening, supportive environment, and health services reorientation. Okay. Now let's try to understand this. Okay. So that and let's take Jakarta Declaration here only because when they can ask Ottawa Charter, they can also ask Jakarta Declaration because Jakarta Declaration was also on health promotion. Now, again, there I was naming Ottawa. It is a capital of Canada. Here I am saying Jakarta. It is Indonesia. No? So the fourth international conference was held in 1997. It was the first conference, fourth international, but it was the first conference which was held in a developing country because Indonesia is a developing country, Canada is a developed country. So it was the first conference where developing country was conducted in a developing country, and it was the first time they involved private sector also in supporting the health promotion. So there is a difference. And this Jakarta Declaration addresses the challenge in promoting health in 21st century. So it said, let's address the challenges which we face in this century. No? And it came out with priorities for health promotion. Okay. Now you can say, okay, what is difference? What is the main difference? One difference that was in developed country, that conference held in developed country, this was in developing country. Okay. Second, you can say private sector involvement was encouraged in Jakarta Declaration, and it was addressing the challenges of 21st century. Okay. But what more? Can we have more so that it becomes easy for us to remember? Yes. Now the Jakarta Declaration, students, you see, it talks about social responsibility for health. Can we promote social responsibility for health? Can we increase investment on health? Can we have a expand and consolidated partnership? Can we increase community capacity and empower individual? And can we have an infrastructure for health promotion which can be secured also? Okay. Now, how do you understand this? See, health is not only possible. It's not possible for one section. It has to be a social thing. Everyone, it's social. Every area, every sectors has to contribute for the good health and well-being. So can we say it is a social responsibility? It's easily saying that, okay, it is a social response, but if you don't invest, how will you have a good health? So investment should be high. It should be a coordinated effect, a consolidated effort. Fourth, without involvement of community, if you don't involve the community, if you don't increase their capacity, if they don't understand about health, different small components, it will be difficult for them to comprehend. So can we raise the community capacity? Can we empower individuals, make them well aware, self dependent? And last, can we secure all those infrastructures which is involved in health promotion? Okay, so these were the important priorities for in Jakarta Declaration. Now let's try to differentiate between two. First, if you see Ottawa Charter, as I said, Ottawa, Canada, Jakarta, 1997. In Ottawa Charter, Ottawa Conference, all the developed countries participated students. So when all the developed countries will participate, they are talking about their problems. So the developing country issues were, maybe neglected or was not taken into consideration. But when this Jakarta Declaration happened, it was conducted in developing countries, so they had their voice, followed by private sector engagement. Okay. Third, Ottawa Charter emphasized that promoting health is more than just providing health services. So he said, okay, promoting health is more than just by giving health services is not important. You have to do more than that. But Jakarta Declaration was very specific. Said that no, let's address all those challenges which is there in promoting health in 21st century. Let's talk of present now, 21st century. So Ottawa Charter gave you a strategies. Now, what could be the strategies? Enable, mediate, advocate. But Jakarta gives you the priorities for health promotion. Priorities, when I say social responsibility, investment in health, capacity building of community. So these are important things. These are the priorities which has to be done. So this is the difference between Ottawa Charter and Jakarta Declaration. Okay, we have done with this, the same thing. Okay. Now let's take this question. Interpret the image and calculate DALY for the given case. So you have to calculate DALY on this. Is it 19.5? It is 18. It is 17 DALY. It is 16 DALY. Now this image based question, and this also helps you to calculate DALY. So this will help you to calculate this, and this will also help you to understand DALY in simplest term. Now DALY, whenever DALY word comes, what we think, okay, DALY, disability adjusted life years. So year lost due to mortality, year lost due to disability, year lost due to disability, year lost due to deaths. This is the simplest way we remember DALY. But let's make it more simple. DALY measures two things, students. Mortality, morbidity. Simple. Just remember this. Disability, whenever you talk about disability, is a part of morbidity, no? And you are in disease state, and the final outcome of that disease state, if it is not cured, is mortality. So DALY measures mortality and morbidity. So now come to the question. A person is born here. Now he is living the green, then you have 0.52, 0.21, 0.65, 0.31, and the person died at 50 years. The life expectancy was 65 years. So as I said, DALY is measured in terms of morbidity and mortality. Let's take first mortality. Now you see this in question. The image says the person life expectancy was 65. The person died at 50 years, premature death. So how many years of life this person has lost due to mortality, due to premature mortality? What will you do? 65 minus 50. So you will say 15 years. So this person lost 15 years. Now what is this 15 years, students? You will attribute this 15 years to mortality. Because the person died here. He should have lived till this point, but this point is 15 years he lost because of death. So this is mortality, 15 years. So can I say 15 DALY he lost? No, 15 DALY he lost due to mortality. But this is one part. When he was alive, there were certain episodes where he was sick, he was disabled, he was not able to perform his routine activities. So if you see the red bars, no, for 2 years he was disabled and the disability weight given was 0.5 here. So when you calculate disability adjusted, that DA part or morbidity in totality, if I say, so this person, 0.5 is the disability weight into 2 years, so it becomes 1. Again he became sick for 1 year and the disability was 0.2, 1, so it becomes 0.2. Again 0.6 into 5, so it becomes 3. Here again he was disabled for 5 years. This time the disability weight was 0.6 and the last one 0.3 into 1, so it is 0.3. So if you see, student, what happens, it becomes 3 plus 1 plus 0.2 plus 0.3, so it becomes 4.5. So 4.5 years this person was not in good health, was disabled, or was severely sick, was in morbid condition. So this much year also he lost due to morbidity. So as I said, DALY measures both. So 4.5, which is due to morbidity or disability, plus 15. So total DALY lost is 19.5. So the answer goes 19.5 DALY. So this is the simplest way of understanding DALY. Don't get into it's very easy. It measures morbidity, mortality. And when you combine, this is the best measure of burden of disease, student. Okay. Now every government is trying to focus on the DALY concept, and internationally, nationally, we are comparing the burden of disease in terms of DALY. Okay. Great. Now, identify this. Identify the larva mosquito. So this is shown here in the photograph. Is it Anopheles? It is Culex? It is Mansonia? It is Aedes? What do you think? Okay. So let's go. Let's try to understand. The answer to this question is Anopheles. So the larva shown in the picture is Anopheles larva. Okay. How do you say that? So it was talking about, so whenever you are reading identification of mosquitoes, larva, egg, pupa and all. So you see larva. What was the picture? If you go to the picture, the larva was, this is the water surface and this is the larva. So can I say the larva was resting parallel to the surface? When the larva was resting parallel to the surface, this is very much commonly seen in Anopheles. Okay. What do you see in Culex? In Culex, students, this is the water surface. You see that the larva will be, this will go just bottom. This will just take an oblique angle. Rest perpendicular to the undersurface, or it may go just bottom to this. Okay, it makes an angle. For Aedes also it makes the same way. Okay. For Aedes also it makes the same way. So the example, if you see, this is a perfect example of Anopheles larva because it is parallel to the surface. Okay. Now identify this. Identify contraceptives method shown in the photograph. Is it rhythm method, cervical mucus method, basal body temperature method, coitus interruptus? What do you think? Okay. Now, whenever such thing comes, students, the answer to this question is the rhythm method. No? Now, but let's try to understand what exactly this means. So, the rhythm method, which is safe period, calendar method, all are same. So, what we do in this, students, we, you know, we take 2 points. First, we ask the lady about the shortest cycle, shortest menstrual cycle. Okay, and then we talk about ask the longest cycle. So, what has been the shortest cycle? What is the number of days in shortest cycle? What is the number of days in longest cycle? So, if I take, let's take an example, 26 days is the shortest cycle, 31 is the longest cycle. Okay, so this is the shortest cycle. From this, subtract 18. From the longest cycle, which is 31, subtract 10. So if you subtract 18 from 26, it becomes 8th day. 8. From 31 to 20, it becomes 21 day. Okay. So this is 8th, from the shortest cycle, whatever you got, which is the 8th day. So this is your first day of fertile period, and 21, which you got, is the last day of fertile period. So you can say between 8 to 21 is the fertile period, and after that, beyond that, days are not fertile. Okay. So this is the way we interpret safe period. Now you see disaster management, National Disaster Management Authority picture is shown here. The chairman of agency is shown. Who is the chairman of this NDMA? Is it Ministry of Labor? Or this is A, B, C, D? What do you think? Ministry of Labor, Defense Minister, Prime Minister, Ministry of Health and Family Welfare. So the disaster, the chairman happens to be the Honorable Prime Minister. Okay, the simple thing. Now you must have seen, whenever you see the insecticides and mosquito killing things, if you see, so you see this image, poison red, this is yellow, then you have danger, then it's caution, somewhat. So what does this indicate? Symbols shown in the photograph is that of what? Is it vaccine safety, contraceptive efficacy, drug toxicity and pesticide? As I have already said, so this is an indication of pesticide toxicity level. Okay. So you have red, you have yellow, you have blue, you have green. So red label is extremely toxic, yellow is highly toxic, blue is moderately toxic, and green one is slightly toxic. So whenever you see this in your house, students, mosquito repellents, just try to see what is the label given, pesticide label. Is it green? If it is green, it is slightly toxic. If it is blue, it is moderately toxic. If it is yellow, it is highly toxic. Red, very highly toxic, extremely toxic. Okay. So they have asked this image also. So this is that. Okay. Come to this. This is a normal distribution curve. In the diagram depicted below, how much is the area between point A and point B? So they are asking you what is the area between point A and point B. Very simple questions. It is talking about mean minus 3 standard deviation, mean plus 3 standard deviation. So as you know, mean plus minus 3 standard deviation, it roughly 99%, but here the exact value is 99.7. So we'll go with the answer C. So as you know, roughly we say 68% is for plus minus 1 standard deviation, 95% for plus minus 2 standard deviation, 99% plus minus 3 standard deviation. So we went with answer C. Okay. Now, try to take this. Now, what is the question says? The question is saying that you have a population, select population, collect baseline data. Somebody developed the cases, somebody developed disease, somebody did not develop the disease. So, and then you compare the case and control. What type of study is this? Is it a prospective cohort, a retrospective cohort, case control, nested case control study? So student, in this case, see, you have selected a population. You are not starting the study from cases and control. So don't get confused with this. You're starting with a population. You have collected the baseline. Over the period of time, somebody developed disease, somebody did not develop disease, and then you from the disease pool you took cases, and from the not disease pool you took control, and then you are trying to compare it. So it is not a typical case control study. It is a nested case control study. So I'll go with the option D, and I'll just try to explain that. What is nested case control study? See this. What happens? There is a defined cohort, population which I took. After a certain period of time, so actually what is nested case control study? It is a cohort study, students, in principle. So you have taken a population, somebody will, you are exposing one group, you are not exposing other group. So somebody will develop disease, somebody will not develop disease in due course of time. So those who develop disease will be classifying as developed disease, and those who are not developing will classify them as that they have not developed disease. So we have two groups, those who have developed disease, those who have not developed disease. So those who have developed disease, from that pool I'll take case because they are disease now, so I'll consider them as case, and from those who have not developed disease I'll take control. And now within that cohort study I'm trying to compare between case and control. So can I say it is a nested case control study? Okay, so this is nested case control study. In simple terms, case control study initiated within a cohort study. So initially the study was cohort only. The cohort study is going on. But since people developed disease, somebody did not develop disease. So from the disease pool we took cases, from not disease pool we took control and tried to compare. So that becomes nested case control study. Okay. Now take this. Now, what is this? Identify the study design given the photogram, assuming 2012 as a present year. So 2012 is a present year, and you are trying to do a follow-up 2022, 2032. So it is a defined population, non-randomized, exposed, not exposed, somebody developed disease, somebody did not develop disease. So what is this? So you are moving forward. So, and the starting year is 2012. So obviously it looks like that it will be a prospective cohort study. Okay. Let's take the next one. Similar picture, but in this question they say the present year is 2012, but the study starts from 1992, reaches to 2002, and then moves to 2012. So you are in 2012, but you are going back in the time and trying to move forward, trying to know what happened, how they were exposed, not exposed, and how they developed disease, did not develop disease. So ultimately you are doing a cohort study only, but you have gone back in the time since your present year is 2012. So you cannot go, you have to go back in the time to for example 1992, and then try to see what happened, how somebody were exposed, how somebody was not exposed, how they developed disease, how they did not develop disease. So in principle that is a cohort study, but since you're going back in the time, so it becomes a retrospective cohort study. Okay. Okay. Just identify this mosquito. Identify the vector shown in the photograph. Is it sandfly? It is Anopheles, Aedes, Culex. Now students, whenever such question comes, just try to see what is shown in the image. In the image, if I ask you, and whatever findings I will show here, just concentrate on that. So you can say that this mosquito is, if I make a line like this, so it is this way. So the mosquito is making a bend at the neck, and then the mosquito, the body part goes like this. So this type of structure is called hunchback appearance. Okay. The mosquito, this is your surface. So mosquito is sitting parallel. The body is parallel here. So the mosquito is parallel to the surface, making an angle here. So the whole body goes back. It is hunchback appearance. You see the wings. Wings are not spotted, and there is no white and dark strips. Alternate dark and white strips. You cannot see. So when this is giving a hunchback appearance, the wings are not spotted, and there is no alternate and black and white strip. So this is Culex, students. Okay. So the answer to this question is Culex. I'll explain the other one also. See this mosquito. Now this mosquito, whatever is shown in the picture I am talking. So this is the surface. Mosquito is straight, no? But making an angle with the surface. If I bring this here, so it makes an angle with the surface, but the whole body is straight. In Culex, the whole body was not straight. Here, the whole body is straight. It makes an angle with the surface. And if you see the wings, so wings are spotted. When the whole body is straight, wings are spotted. It is Anopheles mosquito, students. Now, why to leave the other one? You see this picture. Again, this is the surface. The whole body of the mosquito is like this, again making a bend. Again, it gives a hunchback appearance. Okay? But in this, so you can say this is Culex, but again you have to see that you have black and white strips. So black and white strips, which is a feature of Aedes mosquito. So you also call it as tiger mosquito. So this is your tiger mosquito, Aedes mosquito. So the answer goes C. Okay. So mosquitoes identification is very easy. This is tiger mosquito because you have alternate black and white strips. There is a hunchback appearance and everything. But in Culex, you have hunchback appearance, but you don't have the black and white strips. In Anopheles, if you see, just I go to the Anopheles. Anopheles is very easy. Its whole body is straight. It looks like tail in the air posture. The abdomen is a tail in the air posture. And it makes an angle with the surface, 45 degree. Both Aedes and Culex was parallel. They give hunchback appearance. This is straight. But you see the wings. Wings are spotted. Wings are spotted of Anopheles mosquito. So this is the way students we identify mosquitoes. Okay. Thank you. I hope this small questions helps you, in identifying the image based, and the concepts are clear of the different topics, students. So thank you for it will help you. Thank you for listening this. I hope this serves the purpose. It helps you to understand image based questions properly. With that note, students, thank you. Take care. Bye bye.